The Ministry of Public Service holds the mandate of recruiting and ensuring the welfare of public servants. The performance of the ministry over the last year forms the basis of this assessment. The central question is, what evidence is there that the ministry performed to the expectations of public servants in terms of improving their welfare?
So embarked on pay reforms for civil servants to improve implementation and discipline. In fact, as of July 2024, government has allocated 2.2 trillion Uganda shillings towards the enhancement of salary.
Minister Mululi Mukasa emphasized that in a bid to minimize human-to-human contact, the ministry developed an electronic document and records management system. The system has already been rolled out to 5 districts.
So documents are managed and transmitted and sold electronically. You don't have to have a small boy running around carrying documents and pleading, please, this document is very important, put it on top of the file so that when the big man comes, looks at it before, when it's still fresh. No, just electronic, that's it, and that's it. And the document arrives in time and it is attended to in time.
In the financial year 2019 to 2020, over 195 billion shillings was allocated for salary enhancement of health workers, judicial officers and science teachers. However, other sectors that were not prioritized continue to suffer from inadequate staffing and inequitable remuneration.
We should continue to progressively enhance salaries and improve other living conditions, particularly staff accommodation for teachers, for instance, for health workers, as the economy improves. Now, the progress in this is that in financial year 2022-2023, Uganda shillings 884.648 billion was provided for enhancement of scientists in the mainstream public service, staff accommodation for teachers, that is progressively being addressed as the economy improves. Something is being done. Yes, progressively.
Another key commitment by the ministry is to support local governments in recruiting skilled health workers to achieve at least 85% of the required staffing levels. Despite this, inadequate staffing, especially in newly created districts, has worsened the working environment.
Government has progressively provided money for recruitment of health workers. The demand to provide money for salary enhancement notwithstanding. In the financial year 2024-25, Uganda shillings 25.44 billion has been provided for the recruitment of health workers. And as we talk now, actually the recruitment is ongoing. So the staffing level as at the financial year 2023-2024 for health workers in local governments stood at an average of 87%. while the one for regional referral hospitals was at 62%. So we are moving. Yes, we are not yet there, but we are moving. We are moving.
Minister Mukasa also highlighted several challenges that have impacted service delivery, including the partial implementation of salary enhancements and limited funding to the implementation of necessary reforms.
So what we want, at least let's raise put an increment which will be felt.
Despite these efforts, Uganda's public sector still faces several issues, including lack of national values, poor work attitudes, unethical behavior, a lack of client-centered service delivery, and insufficient initiative to adopt to modern technologies. Lydia Chomkama for UBC News.